really wants the drug, that they may agree to it no matter what. Is that your question?
Yes.
Then I wouldn't be offering it to the person in the first place,
Well,
Mr.
What if you don't know that the person is an addict?
If I don't know the person...
Sustained. 350, 352, 800, 801.
Okay. So, well, doctor, there's a lot of people that are not anesthesiologists here in the state of California that also use propofol, isn't there?
Yes, sir.
A lot of cardiologists use it, don't they?
I don't know a single cardiologist who uses propofol.
How about dentists?
Dentists, I hear, use propofol occasionally in their office. Yes, sir.
How about pulmonologists?
Pulmonologists use it during Actually, I don't know any personal pulmonologists, but I understand they can use it during a bronchoscopy.
How about gastroenterologists?
Yes, sir. Gastroenterologists use it sometimes during colonoscopy.
I mean, it's even used as a sedative for combative patients, isn't it?
I'm not unaware of that. But do you know what all those people have in common, sir?
Did you say you're not unaware of it or not aware of it?
Oh, I'm not. I'm aware of those, of the pulmonary doctors, the gastroenterologists, and the dentists, and the emergency room doctors. I'm unaware of other physicians who use it. The people that what they have in common is that their societies have commented on propofol, and those doctors are made sure they have the didactic lectures to use propofol. They are trained in airway management. They have simulations in their protocols, as well as proctorship when using propofol before using those. So the cardiologists have not commented about the use of propofol, and we do not have that training.
You say you don't know of any pulmonologists that use it?
Personally, no.
And you don't know of any gastroenterologists that use it?
I don't know any gastroenterologists who use it. I know gastroenterologists who do colonoscopies and anesthesiologists use it, but I understand that the Gastroenterology Society has commented about use of propofol by gastroenterologists. But that's the extent of my knowledge.
Now my question was, you don't know any pulmonologists that use it, you don't know any gastroenterologists that use it, and you don't personally know any dentists that use it. Is that correct?
Yes.
But you do know that these fields do use it.
Yes, sir.
How do you know what type of monitoring devices they have when they do use it?
That's a great question. Actually, their societies, when they comment on use of it, they actually outline exactly what I said, the monitoring equipment that's required for use of propofol. They're very careful about that. That's how I know that.
Now, these individuals aren't using it for deep sedation, are they?
They're using it for deep sedation, also in moderate and deep.
Okay, well, what about for conscious sedation? Is there a difference in monitoring required?
I'm unaware of a difference.
Have you ever used it for conscious sedation?
Have I ever used propofol for conscious sedation? Absolutely not.
It is useful for conscious sedation, though, isn't it?
I wouldn't think so, because it's very powerful. It has a very narrow therapeutic window, so people can go easily into deep sedation or even general anesthesia.
Did you form an opinion based upon what you read of Dr. Murray's statement as to the cause of what caused the death of Michael Jackson?
What caused the death of Michael Jackson? It was a respiratory arrest.
Do you know that it was a respiratory arrest, not a cardiac arrest?
Yes.
What makes you think that?
He wasn't breathing, and he had a blood pressure, and he had a heart rate.
Now, how do you know he had a blood pressure?
Because he had a pulse, and he had on the monitor there was a heart rate of 122. You can't have a blood pressure. There has to be a blood pressure.
But when Dr. Murray checked him, he called it a PEA, didn't he?
No. When he found Mr. Jackson, he only left for 2 minutes. He was not breathing. There was a blood pressure and pulse. And then later, There was PEA. You only know PEA when there's an EKG monitor. He did not have an EKG monitor. So there was a pulseless electrical activity. That means there's electricity going in the heart, but there's no blood pressure. That was later when the EMS came over there over 20 minutes later and hooked him up for a monitor.
Okay, now you say over 20 minutes later EMS got there. Do you know how much later it was that EMS arrived after Dr. Murray saw that Michael Jackson wasn't breathing?
It's approximately 26 minutes.
Okay,
I'm sorry. Yes. I mean, I understand that Mr. Jackson was found around noontime, not breathing. He called Mr. Michael Amir at 12:12. He told Mr. Alvarez either at 12:20 or 12:21 to call 911, and 911 arrived at 12:26.
Okay, now you're giving me some information that was not in Dr. Murray's statement to the police, aren't you?
Yes, sir.
And your conclusion as to him finding Mr. Jackson not breathing being about 12 o'clock, that's not from his statement to the police, is it?
I know the 12:12, the 12:20, and 12:26 is all the statement. The 12 o'clock is not in my statement. I did not, when I made my report, I did not know the exact time patient arrested.
And now have you found out?
I hear from this testimony that they're estimating it around 12 o'clock.
And where did you hear that in testimony?
I heard it from, again, I heard it from the telephone. Apparently there was a telephone call or something like that, and they're estimating it's around there.
So am I correct in assuming you're using more than Dr. Murray's statement to the police for your opinion?
When I made my report, and as far as my testimony, I only made that report that there was a delay in calling 911 based on Dr. Murray did not immediately call 911, and then there was a specific delay. I'm just using that bit of information. I don't know exactly what it is, but I know that there's at least a 12-minute. It could have been less or more. But that's the only thing I'm using to estimate that. Yes, sir.
Okay.
I should answer, I don't know. You're right, I don't know.
When you read Dr. Murray's statement,
yes, sir.
He gave a lot of time estimations, didn't he, to the police?
Yes, he did.
And he indicated that he wasn't sure of the exact time, but they kind of just tried to piece it together.
He should have documented the exact times or had someone be documenting. This way we would know.
Well, when he gave his statement to the police, there was a lot of time estimations that he specifically said are not precise.
Yes,
correct?
sir.
And he estimated that Michael Jackson got home about 1 o'clock. Correct?
Yes, sir. He said that.
And that he took a 10 milligram Valium shortly after that and
yes.
took a shower?
Yes, sir.
And he came to bed about 1:30?
Yes, sir.
That he was having trouble sleeping?
Yes, sir.
And it was right around 2 o'clock he gave 2 milligrams of lorazepam.
Okay.
You
Yes,
recall
sir.
that? Now, based upon your knowledge, what would 2 milligrams of lorazepam do to a patient?
I'm not an expert in lorazepam, sir.
Okay, have you ever used lorazepam?
I've given it orally a few times, but I've never given it IV.
What do you give it for?
I give it for sometimes before an MRI. Patient may be very nervous, so we give it to them before an MRI orally, maybe an hour before.
So you give it as a sedative?
Yes, sir.
And you give it an hour?
Mild sedation.
Mild sedation.
Yeah.
And why you give it an hour before?
Because that's approximately when it starts to work. It starts to start.
So it'll probably reach its peak about maybe between an hour and 2 hours later?
I'm not unaware of the exact number, but I think you're correct.
Okay. Now, if you give it by IV, you don't have to wait the hour, do you?
Objection is stated it's never given it by IV.
I'm going to sustain the objection. 801.
Are you aware of the difference between giving it orally versus by giving it IV?
Yeah, yes, IV would act quicker.
How much quicker?
Not sure. I actually think I looked it up for my report, and I think it was 40 minutes.
40 minutes by IV for it to take effect?
You probably know. I don't know.
Well,
for
the
sure.
question is to you.
Oh, I'm sorry.
Mr. Flanagan.
I'm sorry, sir.
No.
If you
Dan?
know from your own experience, fine. If
I
not,
don't know from my experience, but I wrote down in my report 40 minutes.
Okay. Now, do you know anything about the blood level that would be obtained if you gave that 2 milligrams by IV at 2 o'clock?
Objection beyond his area of expertise.
Sustain 350, 352, 801.
Is this beyond your expertise?
Absolutely.
Okay. You also read that he gave 2 milligrams of midazolam somewhere around 3 o'clock.
Yes, sir.
Would you happen to know what kind of effect that would have?
Yes, that would have probably a mild effect. Everyone is a little bit different. I do give midazolam because it's a short-acting benzodiazepine during conscious sedation. So 2 milligrams is a fairly good starting dose. Some patients will be asleep for an hour with it. Some patients, it won't touch them.
Okay, and you also saw that Mr. Jackson gave another 2 milligrams or Mr. Murray or Dr. Murray gave another 2 milligrams at 4:30 of lorazepam
I think it was 5 o'clock.
or 5 o'clock. Okay. Now, as of 5 o'clock, do you think Mr. Jackson should be asleep?
Objection based speculation.
Just a moment, please. Overruled. You may.
I don't know.
Okay, do you know what effect the 2 milligrams at 2, the 2 milligrams at 3, and then the 2 milligrams at 5 should have on Mr. Jackson?
The midazolam should be out of his system. I could comment on that by 5 o'clock. But the lorazepam, I cannot comment for sure.
How long do you think it'd take to get the lorazepam out of his system?
I understand the half-life I wrote down on my report is 10 to 20 hours.
Okay, so you would expect lorazepam still to be in his system.
Yes, sir.
And then you also saw where he gave him 2 milligrams of more midazolam at 7:30.
At 7:30 he gave midazolam? Yes, sir.
And what type of an effect did that have on Mr. Jackson?
If I remember, I don't remember exactly. I think it had very little effect.
Okay. Now, when Mr. Jackson then requested that he be given propofol sometime after 10 o'clock. You recall reading that?
Yes, sir.
And you recall Dr. Murray had a discussion with Mr. Jackson about propofol, didn't he?
I don't recall all the specifics.
Well, they've been discussing propofol basically for the last 3 nights, haven't they?
Yes, sir.
And Dr. Murray had been telling Mr. Jackson that he wanted to get him off propofol. He had to sleep with something else other than propofol. You recall that?
Yes, sir.
And Mr. Jackson was saying it's the only thing that works, correct?
Yes, sir.
And Dr. Murray was saying, but regardless of how it works, you